podcast where we discuss mental health and all sorts of other social issues. Today we have a special guest on with us, Juan Pablo Leon. He is a teacher currently, correct? Uh, in, I believe, elementary school?
Yes, yeah, I teach. Yeah. No, I teach high school English as second language and sophomore English. Yeah.
And he's here to join us to explain a little bit more with Dr. Patino about how ADHD is seen in children, how it's treated, and how the school system plays a pivotal role, as Dr. Patino has said in the past. So, Dr. Patino, why don't you start us off with the questions that you want to ask Juan Pablo?
Well, Juan Pablo and I have known each other for a while, and I have to say that we have a very good rapport into what I do and what he does, and I think that he's a great resource on helping us understand what really happens in the school. We talk a lot among ourselves here about what ADHD is, how it's recognized, how it's treated, but the part that we have some difficulty with is what is it like to have ADHD? What is it like in the school? What happens in school, right? So in your experience, when you have kids with attention deficit disorder, what do you see?
Well, oftentimes you kind of put kids with ADHD in a couple of different categories. When ADHD manifests itself like very physically, and the kid has a lot of like impulse issues controlling their impulses and things like that, and they are a disruption to the classroom setting. Kids get treated very differently to the kids who kind of manifest it internally, right?
So the ones who are more inattentive.
Yeah, or kids who just take longer. Like if the kid just takes longer to complete assignments, for example, due to their ADHD, where it's not so much the blurting out, the constant movement. Those types of kids, a lot of times, teachers can kind of handle those kids better. But because of the the fact that you have sometimes 30 to 40 kids, high school kids in your classroom, the the issue that ends up happening is that you're trying to maintain order more so than trying to meet the needs of this kid, which maybe is more of a state of education issue as opposed to dealing with a child with ADHD issue. But in my experience, when a student has like that physical manifestation, they get kind of categorized as problem kids, right? Which perhaps a lot of your patients come and maybe feel that way.
Okay. Now, in the context of what you said, then you as a teacher actually have a multitude of hats, right? You're trying to maintain discipline, so the ones who can learn better. You have to maintain uh, some guidance for those kids who are either hyperactive or inattentive or both, and who are being disruptive to the class. Do you find it more difficult nowadays to, because you've been doing this for a little while, has it gotten more difficult to discipline the kids in the classroom in terms of setting up boundaries for them?
Me personally, there's always an elephant in the room when you talk about classroom management, and it has a lot to do with gender roles. As a male teacher, it's always easier to um, maintain order in your classroom. Kids come in and they just have a different level of respect for male teachers. So I, I know that's not probably a popular opinion to take, but I know that through speaking to a lot of my colleagues who are mostly female, uh, they all agree with me. I mean, it's something that happens for sure. Uh, that being said, uh, I noticed that teachers who have strong classroom management in general, they take the time to know their kids, to get to know them, to build relationships with their kids. That's the beginning, middle, and end of how you can teach a kid despite whatever challenges they're facing. So I personally have not felt it more difficult to discipline kids because um, you know I'm young, uh, compared to a lot of my colleagues. I'm male. I coach a sport on campus, which a lot of times coaches kind of get a different level of respect and things like that. But um, I know that parents, there are more and more stories that we hear of, helicopter parents and situations where parents are coming to school feeling almost as though they're customers, right? And that's not really the case. You're coming to school and you're receiving an education, a service, right? But
Yeah.
you're not necessarily the customer the same way you are, you know, when you go to a restaurant or something like that. There's certain protocols that need to be followed in the school, and the customer doesn't necessarily know best in that situation. So
And have you found that that situation and the parents being more entitled or feeling more entitled to direct versus participate, right? Do you find that in the kids that have attention deficit hyperactivity disorder becomes more problematic? Because I mean, I can imagine that it creates a confrontational situation into what you're trying to do, a treatment plan or management plan or a 504 plan or an IEP of some of the most advanced programs for more severely ill kids, that the parent wants to be directing those processes versus being participant in it.
yeah, I've been in both. I've been in meetings. The majority of IEP meetings go very smoothly. The counselor or the caseworker or the school psychologist, is actively involved in that meeting, and oftentimes teachers were just there to, you know, say what we've observed in the classroom and what we think works well to help the student. And so I've had both for sure. I've had parents who have had really bad experiences, and I don't blame them because there are schools that don't do things correctly. I'm very lucky to be at a school that does. Um,
Yours is a public school, correct?
yeah, yeah, I do teach in a public high school, and yeah, I'm lucky. It's a great school, and I haven't had any negative or any greatly negative interactions. But I think a lot of the heavy lifting is done by the school psychologists and the counselors in that situation, and they're the ones who end up having to correspond more with the parents, and they probably have different stories than I do. But I've definitely been in meetings where um, parents have had to bring in state advocates and things like that because they feel like it's them against the school in order to get special education services for their child. Where from my perspective, I want the kid to have as many resources as possible to be successful.
Exactly.
If I may, I briefly taught at a middle school here in Scottsdale that was all for kids with ADHD and executive function. A good one third of everything we did in class was based around that. And I remember having those meetings, and this was a quite different because they weren't trying to maintain the child's development in public school. They were paying an insane amount of money. Quite frankly, it was like $22,000 a year for us to take care of it. So unlike the battles that you've probably seen fought, they were the opposite. They wanted nothing to do with it. They couldn't handle their kids anymore, so they wanted us to take care of everything, which is very different than the experience it seems that you're describing there.
Yeah, I
Well,
think yeah.
just let me say that um, there are a couple of issues. One is not all the kids that require assistance in school from that psychologist, counselor, are requiring assistance because of attention deficit hyperactivity disorder. There's a multitude of issues from autism to social deprivation to problems in the household that requires them. So kids are being managed by child protective services. There's all kinds of different things that you have to deal with. And I think it gets seen differently depending on what school you're at, right? I mean, there are schools that have very little resources, and schools that get more resources. And to some degree, the process that the school is going to follow, the way I understand it, should be uniform based on the ADA guidelines from the federal government, in terms of education and limitations a learning that which is a disability. So most of this is directed by federal funding and state funding and so on. But there's some schools that, and I don't know how that works. There's some schools that seem to have a stronger processes, and there's schools that have weaker processes. And it's always been difficult for me to understand how that happens. Is it more of an allocation of funding in terms of the school district? I mean, I don't know. I don't know how that happens.
I think it's probably a there could probably be a lot of different factors. What I've seen because I've taught in two different schools. I taught at a middle school previously to teaching high school, and in that case, it was a manpower issue where we had administrators who were trying very hard to reform the school and fix some processes, to help discipline and behavior and things like that in general on the campus. And so we had a school psychologist and a behavior interventionist on campus, which their job was only to deal with student behaviors and be in IEP meetings and things like that. And so you had two people for over 1,500 students because the administrators were simply spread too thin. Whereas at the school I'm at now, we have almost 3,000 students. We have dropout preventionists that sit in on these meetings. We have multiple behavior interventionists. We have obviously our counselors. We have a school psychologist. So yeah, it definitely is, allocation of, in this case, salaries, I would say.
Okay, so you do find that there's a discrepancy between, I mean, a socioeconomic discrepancy in terms of who gets the best assessment, who gets the best treatment. And right now, you're working in a school district that is more upper middle class, kind of a successful school that has large sports programs and things of that sort, right? And I'm not trying to say that you don't have problems, because I've been very well aware of the problems you've had in your school over the years that may come in different forms, right? I mean, and I remember the school district where you're at, there were serious issues with substance abuse a few years past. There were significant issues with um, uh, discrimination, things of that sort. So, but I think that what concerns me about what is happening right now is something that you spoke about earlier, which has to do with the entitlement of parents to be the directors of the process versus being the participants of the process, right? And I'm not negating that the kids belong to the parents, right, in terms of guardianship and so on. But it seems to me that we're losing that connection of partnership in terms of purpose, right? What is the purpose of a kid receiving an education, especially in high school, which is trying to strengthen values that were learned in early stages of development, maximizing the ability of the child, depending on their limits, to learn so they can be adaptive as they move into the next level of their lives. And from your point of view, um, and I think the only point of comparison you have, because you're fairly young, right? I mean, and I don't want to introduce my past into this because it was a different era, really. I mean, in terms of how things were being done, but in terms of how you're seeing you and your colleagues, not your colleagues, but your peers in school when you were going to high school before college, and what you're seeing now, what do you see different?
Well, I graduated high school in 2011, and I caught the tail end of an era in education that had basically not changed pre the computer, I would say. So when I was in elementary school, middle school, and it started changing when I was in high school, um, and my older brother, he received special education services, so I saw this, through his experience as well. special education, kids who were on IEPs and things like that were kind of exiled. They were in their own classrooms. Oftentimes, kids who didn't even have any sort of formal diagnosis, just because they were, maybe behavior issues and things like that, would get put into special ed. So special ed kind of became this dumping ground for bad kids, right? Fast forward to now, we have kind of more of the expectation is more that kids will be integrated into classrooms, and that is, research shows that that's socially positive for kids with autism, kids with ADHD, kids with anxiety, kids with, all of these things, that they were just getting dumped into a special ed classroom, with rather than changing or modifying the curriculum. My goal as a teacher is to make the curriculum more accessible as it is through accommodations, which is what, when I get into a 504 meeting or I get into an IEP meeting, I like to ask the parents, like, what do you want? Right? Like, here's what I've already told you, what I think your kid needs, what I see, what I've observed. Would you like to see him in a self-contained classroom? Because we can do that. Would you like to see the student, like, it just depends on their needs, but I always ask, like, what is your goal? What is your outcome in this meeting? How can we help you feel good? And a lot of times when you come at it that way, I find that parents change their attitude, and they do want to become more participants in the process. Whether or not they reinforce what we're trying to do in the classroom, that I think that's where we get some issues. You probably feel that way with your patients as well, where you say, all right, here's what you need to do. If there's no willingness to make that change, I mean, how much progress are you going to make?
So when you talk to the parents about their hopes, when they come to the meeting, they're hoping for something. What are the answers you hear from the parents?
99% of the time, they want their kid to get some individual attention. They want you to maybe not be so hard on their kid as far as things like due dates and strict expectations and things like that. And so a lot of teachers get very defensive in that situation. They feel like their accountability procedures are being taken away from them. When really, if you have good classroom management and you have a good rapport with your students, that's not necessarily what's happening. For example, one of the biggest things that I do with all of my students, not just my students who live with any sort of disability, is I allow kids to turn things in late, right? Like, if you had a bad day today, if you're not feeling your best, I don't want to add any additional pressure to you, because that it pays dividends when you feel good going into a classroom, in my experience. So I take care of almost all of my students in that way. Give them a little bit of individual attention, give them extended time to do work. And at times you are going to have to sit down with them and work with them individually, which again is very difficult when you have potentially 40 students in a classroom. But you can solve a lot of your problems that way. And that's what these parents want. And sometimes, that puts more work on a teacher's plate. And that's where I think the friction occurs.
Okay, so when you're allowing the child or the adolescent to have some flexibility and control with the process, do you find them becoming more compliant with what they're supposed to do over time? I mean, of course, you're always gonna have people outside of the norm, right? But do you see that the environment is more relaxed in terms of coming to your class, for example?
Yeah. There's a term that, since like school shootings have happened more and more, the term a safe and secure learning environment has been something that a term that's just been thrown around often when we're discussing schools in general.
Mhm.
But my understanding of a safe and secure learning environment is a place where a kid feels safe to go through the learning process. The classroom has a safe and secure culture where they're not afraid to raise their hand, they're not afraid to ask for help, they're not afraid to communicate how they're feeling or what help they're not afraid in any way, shape, or form. Um, and when one piece of that puzzle that creates a safe and secure learning environment gets thrown out of whack, um, that can create issues. So I think that if you focus on creating a safe and secure learning environment, uh, then yeah, the kids absolutely come to class and their anxiety, maybe their anger, their general frustration with school goes down. Oftentimes I feel like by the time a kid gets to high school, they've especially I taught freshmen and sophomores for 4 years. Um, they've experienced 9 grades, potentially 10 grades of teachers telling them, or in whether they tell them directly or tell them indirectly, you're the bad kid, you're the problem kid, and now they believe it. And so undoing that can be a challenge, but I think that it's super important that we not lump, especially kids with disabilities, that we not lump them into a category, because I've seen these kids, mature and learn coping mechanisms and strategies and become, you know, positive members of the classroom and then eventually society.
One of the issues that I find fascinating, because I deal with these seriously misguided, neglected, and abused kids that end up in the psychiatric hospital because they have depression, anxiety, suicidal behavior, violence, all of those different things, substance abuse. Um, and I think that is a correlation that we see, but not only with the educational system. You said, they've gone to 9 or 10 years of hearing, I'm a bad kid. But there's also a significant component of that happening in the home, right? And when I'm seeing these kids, for me, it's terribly important to understand the movie of the life of the kid and not just the trauma, right? Because very often the trauma comes from neglect, from not being able to tell your child that you're worth something, by not being able to tell the child, you've done a good job, by not providing them with the guidelines in terms of boundaries, in terms of this is appropriate, this is not appropriate, or to the other extreme, that if you're not like me, you're not worth anything, right? Because we want to create mirrors of ourselves. So what I find fascinating in high school is that you're dealing with all the consequences of all of that. I mean,
Yeah.
everything packaged together. And furthermore, complicated by the fact that the kids going into an age time and a stage of development where they want independence. They want to be their own person. And I think that your approach is very useful because you are giving them the freedom, okay, and the boundaries to have choice, but at the same time being responsible for it, right? Because at the end of the day, that becomes the goal. Is not, you see, when we get into helping kids, whether kids with problems or without problems, reach the stage of adaptiveness so they can be adequate adults. Basically, that's the purpose, that they have the tools. We had, as you said, having a secure environment requires the safety, emotional safety to take risks, right?
Mhm.
That you allow the kids to tell me, hey, t-shirt, you're full of it, right? I mean, stuff like that, which I allow the kids to tell me all the time. And I said, fine, that is fine. I can take that. But for some people, a kid impulsively telling you don't know what you're talking about becomes a challenge and a defensive attitude and an argument, right? And that escalates into problems that nowadays spill out into problems with the parents too, right? Because if the kid's being defensive and the teacher is being defensive and the parents are going to be defending the child, we have lost the idea of purpose. What I mean, and I tell the parents this all the time, and maybe you have an opinion about it, but I always tell the parents, it's not about you, it's about the kid. Okay, but I also tell my students it's not about you, it's about the kid. Everybody is working together for a sole purpose of providing a child with the tools necessary so they can live their life as miserable as the rest of us, you know? What do you think?
Yeah, well, the, there's one thing you said that I think we our professions need more of this, right? Like you would probably appreciate more of this from your patients, and I know that I would appreciate more of this from my students and from parents. I find that a lot of people um, lack the vocabulary to express how they feel, right? Like someone might say they feel angry, right? Or someone might just act as though they're angry when actually their feelings are hurt. Like they're not feeling anger like I want to punch you in the face anger. They're feeling pain, right? And like I know that growing up, like my parents at a very early age uh instilled in me that it's okay to tell somebody like you hurt my feelings. I mean, if my brother hit me, I could be mad, right? But if my brother, I was a chubby little guy when I was a kid. If he called me fat, I would say that, that hurt my feelings. I might still go punch him, right? Because that was a way to express myself, right? But
Yeah.
I think that that's super important. A lot of times I tell kids, okay, tell me how you're feeling, and they'll tell me a way they're feeling, and I have a good enough relationship with them that I can say, okay, I think what you're not feeling is anger toward your teacher. I think you're feeling like a lot of times kids will say, I don't like that teacher, right? Like they'll confide in me and tell me they don't like a certain teacher. And they'll tell me why they don't like that teacher. And I'll say, oh, you actually just don't like having someone hold you accountable. Like this teacher is making you do more work than you feel like doing. And you don't like that, right? So what can we do for you to maybe not feel great in that class, because maybe you just aren't going to gel well with that particular teacher, but how can you feel better about the fact that whether you like it or not, this person is going to assign you practice and assessments in effort to educate you on whatever it is, science, math, history, whatever subject they teach. And accountability is and responsibility. I don't know. There's adults who still don't know what that means, right? So teaching
Well,
a kid can be difficult.
we're getting close to the end of the program, but I want to say a couple of things. You're absolutely right in what you said, right? In that kids are always expressing their emotions, whether they know how they're expressing them or not. And I see this every day because I deal with a lot of suicidal kids. And one of the questions I ask is all the time, and remember, I'm not advising anybody to do this. I'm in a hospital, I'm in a controlled environment. I can take certain risks on how I talk to the kids, but I will ask them, you know, what are you really trying to tell me when you tell me that you want to kill yourself, right? Because a lot of kids say they want to kill themselves, but they don't kill themselves. But they're trying to tell you something. And you have to take them seriously every single time, right? Till you get into a professional. But once they get to the professional, we as professionals have the responsibility to ask, what are you really trying to tell me? Because sometimes they're telling you, I need a hug. Sometimes they tell you I feel lonely and empty. Sometimes they tell you I'm pissed at the world because of how I've been treated all my life. But you cannot take things at face value until you have gotten to know and communicate with the person. but always treating them with the respect that they deserve, right? And giving them the space for them to decide how much they want to give you at that moment, right? But we have to um, I'll have to say this: we have to stop being afraid of our kids. We have to start being afraid of the adolescents, and we have to do a better job on educating parents about the challenges of adolescence. It's really fascinating because every single parent has been an adolescent before, right? But how quick we forget, right? What it was like. So we lose the ability to have empathy and compassion for the disruptive and aggressive and sometimes self-destructive behavior of teenagers. Okay, so we have to give them a space. And I always tell parents, listen, you raise your kids until they're 12 years old. When they turn 13, forward until about 25, you just contain them. That's all you do. So our job, once we get to that group of people, is to provide the boundaries for containment and the responses we're gonna have. When they're always gonna be pushing it, right? Pushing the boundaries, but how we can help them get back within the boundaries. And kids are gonna do dumb things. Kids are gonna do impulsive things. But we have to understand that one episode of bad behavior does not define a human being. So we have to look for frequency, consistency, and dysfunction, right? Because kids are going to do a lot of things that the parents don't even know. They're going to smoke weed, they're going to drink alcohol, they're going to try some drugs, and most of them are going to come back to the boundaries, right? So we have to identify who are the ones who stay within the boundaries and the ones that are going to need some extra help so we can provide them guidance into how to get back within those walls. I think that we would like to invite you again to come and join us so we can talk a little bit more about this because I think that there's a lot to be said about uh, the professional teacher parent administration and system interaction. I think that that area needs a lot of growth. And I think that you can at least give us your perspective on how to interact with that.
Absolutely. No, I'd be happy to be on again and shine a little bit more light and dive a little deeper into the specifics of how that works in a school.
All right.
And
Thank you.
Juan Pablo, for people who want to hear more about you, you have your own podcast, correct?
Yeah, I have an education-based podcast called the Mr. Teacher Man podcast. You can find it anywhere that you listen to podcasts, Apple Podcast, Spotify. You can follow me on Facebook, Instagram, and that's pretty much it. Yeah.
Right. Well, Mr. Teacher Man, and of course us here at the Only You. Thank you again for your time, Doctor, as usual, and we'll see
Thank
everybody
you.
again next week.
Thank you, guys. We'll see you.
Thank you.